As we've said, after he came here illegally, Francisco Rodriguez did everything right. He helped the U.S. government keep serious criminals out of the country and checked in whenever he was required to. It's cases like his, though, which are instilling a new fear in the undocumented immigrant community. And as Adam Riley tells us, that could have wide-ranging effects for public health.
As the state's epidemiologist, Dr. Al DeMaria works to track and contain the spread of disease. Around the beginning of June, he learned about a cluster of mumps cases centered in East Boston.
The beginning of mumps can be very nondescript and very mild symptoms, but then the characteristic symptoms are swelling of the salivary glands.
But mumps can also be painful and lead to bigger problems like meningitis and encephalitis. The disease had been popping up at local colleges and universities, but this cluster was different.
Immigrants primarily from South and Central America, to see multiple cases that are potentially related to each other made us concerned about ongoing transmission.
Especially given the current mood among many Boston area Latinos.
I have never seen a community in so much fear.
Gladys Vega runs the nonprofit Chelsea Collaborative and says in the Trump era, it's been hard to convince the people she works with to get even routine medical care.
Our local clinic, people were not keeping their appointments. It got to a point that it was so bad that MGH professionals sent a letter to their patients saying, please come back to us, get your medical care. You're missing your appointment. It's very important for you to come.
But now public health officials needed that same community's trust to ID patients, track their interactions, and convince healthy people to get vaccinated. The response was led by the Boston Public Health Commission, where Rita Nieves is deputy director.
We have relationships in the East Boston community, especially with the neighborhood health center. We contacted them. Our outreach plan included doing targeted outreach to churches, for example, different educational programs.
Also working the Spanish language media and posting flyers that warned of possible exposure. The good news, a few weeks later, is that that response seems to have worked.
We haven't seen any evidence of a spread.
And local immigration policy may have played a big role. After all, Boston Mayor Marty Walsh has offered City Hall as a refuge from deportation. And Chelsea's police have made working with undocumented immigrants a priority. But if federal enforcement gets more aggressive, that sense of local trust could dissipate.
Help-seeking behavior of people may change dramatically if things continue to change in terms of immigration laws. So we are concerned.
And now the Trump administration is reportedly poised to ramp up deportations, which makes a message from epidemiologist Al DeMaria especially timely. His office doesn't share patients' immigration status with federal authorities.
We would never even ask the question because it's irrelevant to what we try to do. All we're interested in is public health.
Adam Riley joins me now. Hey there, Adam.
Hey, John.
You described what's going on in East Boston as a cluster. I'm embarrassed. I don't know exactly what that means.
Yeah,
what does that
I
mean?
didn't either. It turned out there were about 33 mumps cases in and around East Boston involving this particular community. That's compared to 425 so far this year.
And nationally, there's a huge uptick in
Massive
mumps. Yes?
uptick.
What's
It's
that
kind of
about? Do we
terrifying,
know?
actually. More cases last year than in the previous decade. I don't think we know definitely what's causing it, but one factor to consider is, of course, parents who are going against prevailing scientific wisdom and saying they're not going to get their kids vaccinated, even though it is completely safe to do so.
Well, don't get me started
I know.
on that. You suggest in this thing that containment of the cluster makes the case for more leniency when it comes to people here illegally who are nervous about getting medical care. But couldn't it also do the opposite?
It could. I asked Al DeMaria if there was anything about this particular population that made them especially susceptible to mumps, and he said that when people come from countries where the vaccination protocol has broken down, frequently they don't have the immunizations that we want people who are living here to have. So you could take it in that direction. He does not. Again, he really wants anyone who's here in the country now, whatever their vaccination status, to come to them if they have an issue like this. Because it's mumps now, it could be something more serious like tuberculosis down the road.
Thanks so much. Appreciate it.